Hi, I'm Dave Racer. Thanks for taking a few minutes with me today to discuss, well, what we're going to do about healthcare in the United States. We all do agree, I'm sure, that our system is broken. And we know that Washington, D.C. tried to fix it with the Affordable Care Act of 2010, but we also have seen how fatally flawed that system is. Now I'm going to ask you a question. Who wrote the new federal law? Did you? Yeah, I didn't think so. Did members of Congress? I don't think they did either. I think that it was written by some very, very smart people with some very, very smart ideas with which I don't agree, and perhaps you don't agree either. The fact of the matter is that ideological-driven, very smart people wrote this law, and they had a worldview and an outlook about how to reform healthcare that I think comes smack up against the realities of the market. I think there's four major flaws with the legislation. I think, first of all, they asked the wrong question. They asked the question, what do we do to reduce the uninsured rate in the United States? I think that was the wrong question, and it set them off on the wrong journey, and they arrived at the wrong conclusions. The second thing is they never asked you. They never came to people who really work every day in the field, in the trenches, in healthcare. Instead, they went to other smart people like lobbyists and researchers and the pollsters and the special interest groups who always dominate in Washington, D.C. And third, politics drove this law. Even the good ideas were subjected to political compromise, and that's one of the fatal flaws, frankly, of trying to produce political healthcare systems. They just don't work. Ideologues with a socialist bent really drove this legislation. And fourth, they assumed that everybody and everything can be systematized from the top down. If only we put in place the right rules and regulations and set in place the right responsibilities on various bureaucracies, everything can be solved. I don't think any of that works. There's much other concerns about this bill, constitutional issues, financial issues, tax issues, and so on and so forth. And of course, the huge new bureaucracy that it created. I think the law is going to fail. In fact, I think it's failing already in many, many ways. Next summer, it's possible, or next fall, that we're going to have a Supreme Court decision that's going to overturn the entire law. And then what are we going to do? Well, I think we've got to get ready for it. In fact, I think that no matter what happens, whether the court overturns it or not, we have to be ready with answers. We get asked all the time, you criticize and criticize, but what are your answers? I plan to give them to them. My proposition is to redesign healthcare by people who get their hands dirty in it every day. People like you, professional health insurance agents, who understand how people use and abuse health insurance. I'm talking about the physicians who touch patients, the nurses who are in the room, the pharmacists who serve the public, on and on down the list, the people who actually touch the people who are using healthcare. I'm talking about the employers who pay much of the bills. That's the coalition. The Coalition for Healthcare Redesign brings them all together. Now, we're not talking about reforming healthcare. We're talking about redesigning it. I don't think you can reform based on what we have now. What we have now is a mess. I think we need to redesign the system, not from the top down, but from the bottom up. Now, I'm going to do this a number of different ways if I can have your help. But my primary objective in the short term is to produce a book to release next August, right in the middle of the election season. And it will be a book of ideas. In fact, I, for lack of a better title, call it 1001 Ideas That Really Work to redesign U.S. healthcare. I can't do it without you because I don't know all these things. I'm just another top-down guy, I guess. No, I'm a bottom-up guy. And in order to understand the best way to do it, I'm calling on people from all walks of life, professionals in the healthcare system like you, to join together with me in the Coalition for Healthcare Redesign. Will you go to www.COHR online, that's COHR online.com, take a look around, and hopefully you're going to work together. America is a great, great country, but we are in serious, serious jeopardy in many, many ways. And I believe our healthcare system sits right in the middle of that debate, and how we resolve this question is has a great deal to do with where we end up as a nation. So I want to build on our strengths and recognize individuality and market forces, not try to force everybody into a shell from the top down. If you're with me on that idea, if you think that makes sense, then I hope that you'll give us some thought and come together in the Coalition for Healthcare Redesign. Thanks so much. God bless you, and God bless America.